iPrep was developed as a tool to identify trainees who may be at greater risk of injury when they join the Army. It includes 2 phases, a screening phase and a training program. Since October, all new soldiers are screened so leaders can decide whether they go on to basic or enter the iPrep training program. So far, results are good.
We're doing the best that we can to try and identify an individual that may be more predisposed or have a higher propensity for injury than somebody else. The data that we have collected is favorable, that those that we have identified as needing to go into the initial entry training physical resilience enhancement program, or iPrep, have done better than a comparison group.
iPrep screening measures cardiovascular endurance by requiring trainees to complete a 1-mile run in under 8 minutes and 30 seconds.
305.
The assessment also includes a pull-up to measure overall strength and 2 movements from the functional movement screening that are most critical to injury identification: a trunk stability push-up and a deep squat.
It's an overhead squat. They hold a dowel rod overhead with their elbows extended, their feet are shoulder width apart, and their goal is to go down below the 90-degree mark at the knees. What we're looking for, are they able to maintain that dowel directly in line with their head, their hips, and their feet.
The trainees are graded from 0 to 3, a 0 if they have pain and a 3 if they can complete the movement perfectly. If they are unable to do so, they are given an alternate position.
With the deep squat, if they're standing on the ground and they can't perform a 3, they don't move perfectly or pristinely, then we put them on a board that's elevated about 2 inches. That kind of takes their ankle mobility out of the equation, and it just makes the movement a little bit easier.
In addition to the physical test and the 2 components of the functional movement screening, there is a shoulder and 2 spine provocation tests that deal with flexion and extension.
We also have 3 pain provocation tests that we look at to see if they're not reporting pain. Can we do some movements to see if the movements cause pain? So the first one, it's a shoulder pain provocation test. And we ask them, do you have pain? And we can also see from their expression, do they appear to be in pain?
To prevent future injuries, a team of cadre, physical therapists, and athletic trainers meet to review individual scores. Soldiers who receive low scores or are unable to complete an aspect may be diverted to the iPrep training program. Katie Cook, Fort Benning TV.